Welcome, students. Today we're going to demonstrate the head-to-toe assessment that you will need to do a return demonstration. So the first thing is you need to gather your supplies, and what you will need is a pen light, a pulse oximeter, a thermometer, a stethoscope, a blood pressure cuff, and a pair of gloves. So come with me while I go into our patient's room and introduce myself.
Yes.
Good morning, Ms. Cortez. My name is Donna Badowski, and I have some COD practical nursing students here to demonstrate a head-to-toe assessment on you. Do you mind if the students observe?
Yeah,
Okay. Well, the first thing I'm going to do is perform my hand hygiene. And then I'm just going to do a quick check of your ID band, and that says Maritza Cortez, and your date of birth, please.
12/23/85.
Okay, thank you. And then I'm going to raise the bed so that it's at proper working height for me. Here is the pump. Are you in any pain? All right, so can you tell me where you're at? In the hospital, okay. And your name again?
Maritza Cortez.
And do you know the reason why you're here?
Yeah, I had an accident.
Okay, sorry to hear that. And then, do you know what time of year it is, like the season?
Winter.
Okay, great. So that's an assessment of her level of consciousness. She's, obviously we can see she's awake and alert, and she's oriented ×4. Person, place, time, and situation. Okay, so now I'm going to take your vital signs, and I will take your temperature first. Okay, 98.0. I'm going to do your pulse ox on the finger. Stethoscope's not cooperating with me. I'm going to do it on this finger because I'm going to take your blood pressure on this arm. That's 130/88. And your pulse ox is 97, which is excellent. All right, next I'm just going to look at your face, and everything appears normal. I don't see any lesions or any kind of abnormalities. Next, I'm going to ask you to take your glasses off for me because I need to check your eyes. And I'm just going to shine a light in your eye. So just stare at me. And just looking at the response of your pupils so that they constrict with the light, and that's normal. And then I'm going to ask you to open your mouth so I can just check the inside of your mouth. Nice and pink, and your oral cavity, all the mucosa is intact. And it looks like those are your own teeth?
Yes.
Okay. Do you have any swelling or pain in your mouth around your teeth at all?
No.
Okay, great. All right, the next thing, I'm just going to kind of just feel your neck a little bit just to make sure there's no lesions or lumps. And that's normal. All right, so I'm just going to keep moving down. So then students, after I've checked her head, as we're looking at her skin on her face to make sure there's no lesions, lumps, any kind of abnormalities. And then as we continue in our head to toe fashion down the body, we keep noting any kind of abnormalities with the skin. We're looking for any kind of reddened areas, especially paying particular attention to the pressure points that are, laying on the bed a lot. And then we're going to proceed down her arms next, and everything appears normal. And then I'm gonna check her peripheral pulses, which would be her radial pulses. I check them bilaterally, and they are strong and equal. And then I'm going to do a hand grasp. Can you squeeze my fingers? Okay, good, you can release. And that was strong and equal. And then I'm also going to check her nail beds and do a capillary refill. And what I'm looking for is when I press down on her nail bed, and when I lift up, it goes from white to pink within less than 3 seconds, and that would be a normal finding. The next thing on our head to toe assessment would be to listen to her chest, which would include the apical pulse as well as her breath sounds. And again, while we're listening to her chest, we're going to be assessing her skin. Okay, so I'm going to demonstrate on our skeleton where you would find the apical pulse, the anatomical landmarks that you need to find that apical pulse. So I'm going to show the anatomical landmarks to find the apical pulse.
All right.
So we want the left mid-clavicular, which means the middle of the clavicle, and we're going to count down to the 5th intercostal space. So you can, intercostal means between each rib. So we're going to count 1, 2, 3, 4, 5. So the point of maximum intensity where you're going to hear the apical pulse the loudest is going to be right about here, which on the mannequin I will demonstrate. Again, mid-clavicular, 1, 2, 3, 4, 5. And you can see it's just pretty much below the nipple area. And then you would put your stethoscope there. And you would count for 1 full minute. Okay? And since we're right here on the chest, we have the stethoscope in our ears, we can move right into the breath sounds.
Mm-hmm.
One thing I failed to say, okay, you do count for 1 full minute while you're taking the apical pulse, and then what you will do is keep your stethoscope there for an extra 30 seconds so you can count the respiratory rate. And then you'll move into your breath sounds.
Alrighty.
We never want to tell the patient we're counting their respiratory rate because that is the one vital sign that they can't control. So now I'm going to go right into my breath sounds, and I'm going to ask the patient to take a deep breath in and out. And then I'm going to move to the left side because you always go in a zigzag pattern. So if you start here, then you'll go, if you started on the patient's left side, you'll move to the right side. Take a deep breath. Another deep breath. Again. Again. Yeah.
Go ahead.
And then I'm going to have you take another deep breath. So I'm off to the side.
Lateral, okay.
And then I'm going to the other lateral aspect.
Okay.
And then you would ask your patient to sit forward. And this is the time when you can look at the skin on their back.
You want to do that on me?
Okay.
Sure. How's it going over there?
And since it's going to be hard for you to see on the camera, you would just do the same thing. Whatever side you start on, you go to the opposite side, and then you do a zigzag pattern and work your way down, kind of like that.
Like that, perfect.
Okay? And you'll be listening to 6 areas on the posterior side. And again, assessing the skin condition.
Gotcha.
Okay, so now we're going to move to the abdomen. And we need to listen to all 4 quadrants.